Thank you for being here. Thank you again for covering this news that seems to be changing daily and every hour and sometimes. I'm Pete Meitzner. I'm the chairman of the Sedgwick County Commission, and we also serve as the Sedgwick County Board of Health as part of our commission mission. So we're here today to provide an update on the recently signed order from Dr. Menz. The worldwide outbreak of COVID-19, which is now spreading in Kansas and in Sedgwick County, continues to threaten the lives and health of our residents and our visitors. On Monday afternoon, that was yesterday, the Board of County Commissioners, acting as the Board of Health, recommended that local health officer Dr. Gerald Menz approve a 30-day stay-at-home order. That order is necessary to protect residents and our community from the spread of the novel coronavirus, which causes the disease, COVID-19. The novel coronavirus continues to spread rapidly across the globe and has now reached our state and the Sedgwick County community. We can report today that a fourth person in Sedgwick County has been identified as a presumptive positive for COVID-19. Bear with me, thank you. I now want to introduce Dr. Menz, who will speak about the need for stay-at-home order for the stay-at-home. Under the state statute, the local health officer is the authorized person to prohibit public gatherings and take other needed measures to prevent the spread of an infectious disease. So I will now introduce Dr. Menz.
Thank you, Chairman. To reduce the spread of COVID-19, I'm approving the stay-at-home order that County Commissioners recommended on Monday. The order will take effect later tonight, specifically 12:01 a.m. on Wednesday, March 25th. Along with my opinion that a stay-home order is warranted, the Medical Society of Sedgwick County is recommending we take action to limit the spread of this virus by issuing an order to shelter in place, stay at home for all but essential business services. This virus is expected to infect 40 to 60% of the population. Putting the estimated mortality rate at 3.4%, it has been documented that 17% of those infected require hospitalization. To slow the spread of the coronavirus and protect our most important community asset, our people, we must take the actions necessary during this imminent threat. These actions include the previous cancellation of large social gatherings and the practice of social distancing even when you are in smaller groups. Social distancing strategies like stay-at-home order are effective when implemented early enough. These strategies are essential for flattening the curve and making sure that our healthcare system does not become overwhelmed with patients. Please understand that though stay-at-the-home order, social distancing, and good hygiene habits, our community must help slow the spread of the disease and avoid overwhelming our local healthcare system. These measures will help ensure that our healthcare professionals can help the residents who develop severe symptoms. We know that stay-at-the-home order is going to change our daily lives, but this order is necessary to protect residents, avoid spread of the disease, and save lives. Thank you, Chairman Meitzner.
We're going to have a few more speakers. The mayor is here, the Sheriff Easter, Chief Ramsey, District Attorney Bennett, Elora Forshey, who manages our 911 department. So before we move on with the next speaker, I want to try to describe the order in the simplest way we can. The key word is essential. If you're an essential business operating in the city or the county, then you are allowed to continue to operate under the rules with the social distancing and anybody that you can have as an employee work from home. So essential is the key. To the citizens, this essential services If you're looking at something that you think is essential for you to live your life, then it usually is going to be in this order. Essential could mean helping visit your aged mom or dad, could be taking care of your kid, could be running an errand with your pets to the pet store, groceries, taxes with your attorneys, all of these things that are essential for you to live a fairly normal life. So it also includes health care, I said grocery stores, even markets, it's pharmacies, government services, child care, drive-through. We are drive-through and delivery carry-out services from restaurants, if the restaurant chooses to remain open. The essential activities also that I've referenced could be your help for public health, public safety workers, anything related to the health and safety, doctor visits, trips to obtain food or supplies, trips to care or transport family members, outdoor activities as long as social distancing, the requirements are met. There is a complete list of all 26 essential services and activities that are exempted. You can visit that at www.sedgwickcounty.org. You may also call 316, this is important, 660-9000, or email stayathomefAC, that's all one word, stayathomefAC, frequently asked questions, at sedgwick.gov, if you have any questions related to the order. Now I would like to invite Mayor Whipple, and thank you for joining us, Mayor. I know you're a big part of this county, and thank you for being here and joining us.
Well, yikes. I want to thank everyone for being here. This is really unprecedented. We're at the point right now where there are no easy decisions, only the right decisions. And I want to thank the county for really putting the safety of our community over what would have been politically easier, which is pretending that things aren't that bad. We have one shot at doing this right. And we know this because of the data and because of what we have seen from other countries. If we do this right up front and slow down the spread of this, then we can actually, hopefully, be able to, our medical community can handle this. In the yesterday I was on the phone with members of the county commission, but also with the people who run our hospital sector here in Wichita. And they are overwhelmingly in agreement that this was the right thing to do. That for us to slow down the spread, for us to protect the most vulnerable citizens in Wichita, we need to get in front of this. And I want to somewhat describe this because I've been getting a lot of questions on social media. And I'm trying to put this into context because as a community, we have never dealt with something like this. This is completely new to us. But we have dealt with weather, right? We have dealt with storms. So I want people to realize that right now what we're asking you to do is that we have a storm coming and we need to bunker down right now and make sure that we are keeping ourselves safe. So during this time, please take these precautions, stay home, go out only when you need to, when it's necessary. And we're gonna get through this better as a society, as a city on the other end. But for right now, this storm is coming. We need people to take it seriously, to bunker down. Let's get past it. And then after we get past it, we're gonna rebuild and we're going to make Wichita even better for going through this. So with that, I do wanna again thank the county for coming to what I believe is the right decision on this. It is not the easy decision. It is going to be tough coming through, but it's not about us, it's about our neighbors. It's about our community, and we are in this together. So please, educate yourself on what this order means. Also, continuing practicing the best practices so that as a community, we will have the ability to give those who become affected the best chance to get the health care they need. Thank you.
Thank you, Mary. Your support is vitally important for us as we whatever it is through this tough stuff. So next up is Elora Forshey. She is the director of our 911 service. You all know what that is, and she is the lady behind the scenes that makes sure our 911 service operates. Thank you for being here.
Thank you. As mentioned, my name is Elora Forshey. I'm the director of 911. As we are watching what other communities are going through, we are learning from their lessons in many facets. One part that I am watching closely is how 911 services are being impacted in these other communities as they are ahead of us in this crisis. We are seeing and learning lessons from them that their 911 services are being inundated with calls, and a lot of them are calls that should be handled elsewhere. I want to get ahead of that and think strategically as a community about how we can protect this very precious resource. We know on top of the call volume increase that we are going to have staffing shortages because we are not immune to this either. Our most precious resource at 911 is our staff, and those staff are also having to grocery shop and take care of kids and parents and things like that. So I'm going to have team members that are going to get sick and are going to need to stay home. So those two things combined come to me to ask you to help us to protect this. So we have some things in place that I want to make sure that you guys are aware of. If you have behavior that you need to report that you believe is a public health concern, or as it pertains to that stay-at-home order or gatherings of more than 10 people, we are asking you not to call 911 for those. Instead, we have a phone number set up. It is 316-660-9000. Again, that is 316-660-9000, or you can email those to stayatHomeFAQ@sedgwick.gov, as Chairman Meister mentioned. Please, again, do not call 911 for those. Anybody that has a COVID-19 question, if they are concerned that they need to be tested, something of that sort, and they don't have any emergent symptoms at that time, they need to call over to the United Way of the Plains at 211, or you may email covid19@sedgwick.gov, that's sedgwick.gov. So please don't call 911 for those things. There are going to be times, though, that you do need to call 911, and our staff is going to be there ready to take that call. They are ready to serve our community during this time of crisis. If you are experiencing chest pains, severe shortness of breath, and again, that's only able to say one or two words between taking a breath. If you've passed out, lost consciousness, or are confused, have severe symptoms that need medical attention right away, and you are unable to get to a hospital on your own safely, please call 911 for those reasons. So again, we don't want to tell you not to call when you need the help, but please be respectful of that resource and know that our lives are going to continue at home, and there are other emergencies that are going to happen aside from COVID-19 that we're going to need to respond to. Lastly, I would also tell you, if you're calling 911 to report anything of any nature and you believe that you've been exposed to COVID-19 or have COVID-19, please disclose that information so that we may disclose that to first responders. This helps them to take appropriate precautions to protect themselves, their families, and continue to support and protect our community. We are still going to respond. You will still get the care that you need. We just want to make sure that everybody stays safe as we treat this crisis in our community. We appreciate the support from those out in the community that have expressed it, and we will continue to be there throughout this. Thank you.
We also have Sheriff Easter and Chief Gordon Ramsey that wants to say a few words. And first off, Sheriff Easter, Chief, welcome.
Hello, Gordon Ramsey with the Wichita Police. I wanted to talk a little bit about our response to the new order that is coming out. From a police perspective, our focus is going to be on education over enforcement. Our goal is to slow the spread of the virus. We understand the concerns that community members have on all sides of this, but ultimately our goal is the same, to slow the spread. Approaching this issue We will be focused on working on from a caring and compassionate and confident angle. We want to make sure that we are taking care of our citizens, responding to calls. We will be there when you need us. And your police department is used to working in a crisis-filled environment. That is the police world, is crisis. We've been putting plans in place for several weeks now, and are confident that our plans will work out for our community. Today, we're going to be announcing some further changes to our responses that include the activation of the emergency accident reporting, where if you're involved in an accident and your vehicle is movable, you are to go to online reporting or fill out reports online versus having police response. There will be more information released, if it hasn't already been, to media as well as the community through social media. When you have an emergency at your house and you need the Wichita Police Department, we're going to be there. We've been making these changes to response in terms of, if you do not need a police officer come to your home, we will do so over the phone. But if you have an emergency, we will be there. We will be triaging calls where, if it can be handled over the phone, a police officer will call you instead of responding. And the purpose of that is to slow the spread, keep our staff healthy and available for emergency calls. We have added staffing to a phone bank that is being staffed by officers around the clock. So we feel there's more than sufficient staffing that are available on phone calls to assist those people that may have questions or need to provide a report over the phone. Again, our purpose is to slow the spread. The points that I've made today will all be online, as well as information on IRP, as we try to keep our officers safe and our community safe and slow the spread. Thank you.
Good afternoon. What I want to start off with is the fact that, when I've traveled around the United States, or when folks have come here to Wichita, one of the biggest things that they talk about is how friendly people are here and the hospitality that they've received when they've come here. So I want the citizens to remember that. We need to stay calm during this process. It's going to be a difficult process to stay at home and those type of things, but that's what we're asking you to do. You've heard from all the officials here of why that is. Now, with changes within the sheriff's office, what we're looking at is continue to call 911 if you're in need of our services. Our services have not changed per se on how we are operating in the field. However, what's going to change is the same thing that Chief Ramsey talked about, is we have individuals that are going to be monitoring the phone systems. 911 will transfer a call if they see that it fits the criteria that we're looking at, and you will have a deputy take the report over the phone. And the reason for that is the distancing. We have to keep our people healthy as well, and so some calls you will not have a deputy responding. But that does not change the level of service that we're going to provide. The reason being for that is if a citizen sees something that is suspicious, the typical things that we tell people to call 911 on, continue to call 911 on those criminal activities. The other thing that we have done that we announced the other day is on our website at www.sedgwickcounty.org/sheriff, that's SHERIFF, we have a COVID-19 tab. That particular tab on our website, you will see any changes or updates that we have with any relation to the COVID-19 issues that we're having. So I would strongly suggest the public to go to that website to find out any new information, any changes that have been put in place, and or changes that could be put in place at a later point. The other thing that we're doing is we are implementing the emergency accident reporting plan. This plan, which is referred to as IRP, basically if you have a non-injury accident and the vehicle is operational and there's no impairment that is observed, to go home and then report the accident. We will be giving updates later today in reference to how to submit those accident forms. We should have a PDF on our website later on today that you can download and then mail it back in. We'll work with IT staff to come up with a link or some other mechanism to be able to fill out the form online, hit the send button, and it would come directly to us. We will announce that when we have that up and ready to go. One last thing that I have is that we've put out, and I just want to reiterate, the jail lobby is closed to the public, and so there's no reason for the public to come down to the Sedgwick County Jail at this point. If there's something that you need to meet with administration level, that's by appointment only. Thank you.
Next up is the District Attorney, Mark Bennett. Thank you for joining us.
Thank you. The Office of the District Attorney is going to continue to be open for business. We've got essential personnel in the office to make sure we maintain our statutory obligations to the citizens of Sedgwick County. We're reviewing cases that are brought to us each morning in custody from the night before. We're obviously taking a careful view of how many more people we're going to put into the jail right now so that the sheriff has a manageable population over there. We're also working with the court system, the judges, the court administration, defense bar in Wichita to try to take a test run in the morning where we're going to do sentencings and probation violation hearings remotely using you may be familiar with the first appearance equipment. You've seen a first appearance take place where a defendant appears on screen in front of a judge. We use that process to try to do some of the work of the courthouse so that we can continue to do the business of the people here in the courthouse without slowing down entirely. So it's a work in progress. This is fairly uncharted territory, but my office is continuing to work with law enforcement to do our best to keep folks safe. In terms of this new order from the County Commission and the Health Director issued today, I would simply say, I'd ask that the folks in Sedgwick County do what we've always done and exercise good common sense. Stay away from folks and help us get through this virus and keep the risk to a minimum. The sooner we get through this, the sooner we get our businesses back in motion. You can hear me at this point, so I'll just say the sooner we get over this, the sooner we'll get back to work. So thank you very much.
Okay, with the background noise, we'll have a couple of closing comments and then we'll have some questions. I want to take a second to thank my fellow county commissioners who are all here. They've been working nonstop all weekend, 24 hours basically, a lot of information. I used to be in the telephone business, and if you saw our hallways today, it sounded like a call center with every commissioner on the phone talking to somebody answering the phone themselves. So I want to thank them and obviously all of our partners that we just looked at. So a couple of points. This stay-at-home order was not done in a vacuum. Johnson County, we mirrored it 99% after what Johnson County has done, who is kind of ahead of us in a number of cases. Johnson County worked closely with Wyandotte County and across the state line in Jackson County in Kansas City. So staff and attorneys and all the healthcare providers in the Kansas City region, as well as law enforcement, all came together to come up with what they believe was a solid and vetted order. That's what we have mirrored to the large extent. It would have taken us a really long time to try to invent this from scratch. So I want to thank our partners in Johnson County. Commissioner Dennis and I are talking to Johnson County Chairman quite often. I want to also point out that in the order, there is no words like lockdown, shut down, call in the National Guard. None of that is in this order. It's to allow you as a citizen to live your life with the essential services for businesses that are essential. That includes our construction companies that are building great buildings right downtown. And it includes our car dealers and major people like that. So we want the Sedgwick County citizens to know that we're working with our health experts daily, our community partners. We've put operations in place and plans in place for public safety and public health departments, as well as offices of the county clerk, register of deed, appraiser. We're staying aware of new developments as they happen daily, and I encourage citizens stay up to speed with what we can provide and also what's going on at a national level, along with when Governor Laura Kelly issues something. So we're trying to get this information available, and thank you, media, for continuing to follow this closely and interrupt your programming to make sure that the public stays informed. It's just, y'all have heard this, but this hygiene is important. The 6-foot zone is important. Cleaning your hands, alcohol-based, all those things that we've talked about before are vitally important so we can try to contain the spread until we get a solution around this. If you have a fever, cough, and difficulty breathing, those are the signals that you need to seek some medical attention. Call your personal health provider, or if you don't have one, you can call United Way's 211, as we talked before. Calling in advance will allow your health provider to quickly direct you to the right facility. We will get through this. It's a tough situation. But if we're going to make any headway against the virus, we have to flatten the transmission curve. Again, follow the advice given to your healthcare providers and your national and local public authorities. If your residents have questions, last reminder, please visit sedgwickcounty.org, or you may also call the number 660-9000. And a reminder, the website or the email is stayathomefac, FAQ, that's all one word, at sedgwick.gov. So with that, we'll close the press conference, and we are available if it will take a few questions. So thank you again. The order is in place for 30 days, but it can be changed or altered in a quick moment with the advice of Dr. Menz, or with breaking information. And I think our county commission is well aware of that. We've had urgent meetings every day so far this week, and we will continue to, but 30 days is what it is, and that mirrors what Johnson County did as well. Yes. Yeah, Dr. Menz.
Just curious, what made you change your mind and approve this order on Sunday? You weren't sure it was necessary.
I think feedback from the medical community was helpful. I also think the fact that we had another case yesterday showed us that it's still on its upward swing. So those factors in combination, plus the commissioner's vote, I think was very impactful. I have to be. I don't like the alternative, so I hope for sure it does work.
Yes. Laura, question for you.
Yeah, I know a big issue is mental health following coronavirus. I'm wondering if you've seen an uptick in mental health calls and such.
I've not seen an uptick in that. And yes, whether or not we've seen an uptick in mental health calls, no, not specifically. We've actually seen, and I hold my breath as I say it, a downturn in calls over the last couple of weeks. I think because everybody is staying at home and working from home, and so we're not seeing a particular call rise in any area. But that's definitely something that we are monitoring. We're kind of keeping a gauge on the city in general and the county in general, based on what we're seeing coming in through 911. And if we see that, we would definitely be getting our other partner agencies involved, such as ComCare and our commission, and to see if there's something we can do to help with that. Yeah.
I'd just add to that when we went to 250 people on Friday, events were canceled, such as the St. Pat's Parade. That was on Friday at noon, so the community was very supportive. And then as soon as Monday at noon, we went down to 50. And now, thanks to the governor's decree, it's 10. But I asked Laura, are we getting calls on over 50 gatherings, and no. So thank you to the community for being responsible, not hitting the panic button, and we're a good community, and we really are. We've got a great YMCA program, we've got great school system, private school system, and that's what we do as a community, and I want to thank everybody for cooperating so far. Any other questions? Okay, oh, yes, sir.
Easter or Randy kind of talk about enforcement and citations, if those are going to be issued for people?
Yeah, the question is about enforcement and any citations. Either one of you want to handle that?
I'll just say the state statute contemplates that a Class C misdemeanor can be issued, and which is not typically an arrestable offense, but that's when there's a quarantine order in place. That's not where we're at right now. So I'll just echo what Chairman Meitzner and both Chief Ramsey and Sheriff Easter said. As right now we're asking people to voluntarily comply with this, simply do what we've been doing, which is stay at home unless you have to be out, and use your common sense. And that's how law enforcement's going to handle it at this point. If at some point everything flows from the state statute, if the statute allows the medical director to issue to issue something more specific, when he does so, then more additional powers will be granted to law enforcement. Right now, we're not there yet, so this is largely a request to folks to be as compliant as possible, use your common sense, and try to avoid the spread.
Just one more question?
Yeah. Is there reason that there's so many exceptions to maybe install some of that panic that you had mentioned a few times?
Well, you make a good, the question was, is there a reason there are so many exceptions? And that's a great question, one that we had ourselves, but in conversations with Johnson County and knowing the tremendous effort they put behind to, to just make sure like pet stores remain open and laundromats, because people don't have washers or dryers. So you could tell they did a lot of and they said it didn't get there easy. There's a lot of things. They consider parks to get outside and get some fresh air, allow people to walk around. So that's kind of where it came from. It is a lot, but I think when you read it, it says you can live a close to a normal life, at least the essential services. And we're going to rely on the grocery stores and these services to determine how they're going to manage themselves. The construction companies already said they're cleaning stuff, the spirit, how do you keep people distancing? That's up to their operations. We want the grocery stores to be able to control the crowds the best they can, and their checkout clerks. I mean, we're hopefully get some personal equipment, gloves, things like that to those people. And we're working hard nationally to try to get the personal protection clothing so we can distribute to these essential businesses.
Commissioner, one news outlet is reporting you can't walk your animals outside.
All right, there's another rumor that you can't walk your animals outside, and that's not a violation. Walking your animal is essential versus keeping them inside your house, I think.
What are some examples of businesses that will be affected by this and have to close?
Well, an example would be businesses that come in direct and long-term contact with a person, such as hairdressing, barbershops. So if they've got their hands and they're in direct contact, and that's considered non-essential. So there'll probably be a lot of people with, their hair's growing out for those that do it. So that's an example. And other examples are non-essential, like game shops or entertainment centers that are really not essential to have to go to.
What about retailers that don't offer food, or like clothing retailers, most major retailers that don't have food?
Well, and this last question, because the retail markets, if it's essential, if it's just a specialty clothing store, that's not essential. But it's the Walgreens and the other supply places those remain open. So we have a complete list again for everybody, and I can't thank you all for sharing this message with our public. And I want to thank again Mayor Brandon Whipple for joining us on behalf of the City of Wichita. And we will tell you again when we have to come back again and share more information. Let's hope we've bottomed out. Let's hope it doesn't go much lower. Then we can start talking about how do we loosen and recover and start our road back to a good city and county. Thank you very much.